Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. On Guam, thousands of people are diagnosed with diabetes each year. Across America, more than 20 million are affected. It's a lifelong chronic disease in which there are high levels of sugar in the blood. The pancreas produces a hormone called insulin, which controls blood sugar. Diabetes occurs when you have too little insulin or your body becomes resistant to it. Here to break down all of this and tell us about how your diet can affect the disease and the drugs that are available to treat it is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in.
Thanks,
so we got a double dose now of diabetes. We're actually going to be talking about this week and next week. But let's talk a little bit, break down for us how diabetes occurs in somebody's body.
Okay, well, as you mentioned, when we eat food, whatever food we eat goes into our stomach, gets ground up and absorbed into the bloodstream and becomes sugar. Anything, and the medical name for that is glucose. So whatever you eat will become fuel, sugar in your bloodstream. Now that sugar needs to go to the place where it's going to be used, which is the muscles, the heart, the brain, all the different parts of our body that need fuel to function, all the different cells. To get that sugar into the cells, you need that hormone insulin, and that is produced by your pancreas. The pancreas is a little organ, little flat white organ that sits right behind your stomach, and whenever you eat, it will squeeze out some insulin. So you eat food that becomes sugar, that sugar needs to get out of the blood into the cells with the help of that insulin. And that's normal metabolism. Now, in type 1 diabetes, your pancreas gets destroyed by your own body. It's an autoimmune disease that tends to affect children and young adults, but it can also affect older people. But in that disease, basically the pancreas is destroyed, so you're not making any insulin at all. In type 2 diabetes, which is the most common form that we have on Guam, it tends to affect overweight and older people. And in that situation, the body does make insulin, but it's resistant to it. So as the insulin is being pumped up, this sugar stays in the blood. It's still not going into the cells where it's required. And that high blood sugar, if you think of a sticky, sweet blood plugging up things, that's a very simplistic way of describing the problem in diabetes, is that the sugar is actually destroying many organs as the blood circulates through your entire body. We know the complications, injuring your eyes, your vision, your heart, causing strokes, destroying your kidneys, all because of that very high blood sugar.
Now, a lot of times I think they call diabetes the silent killer, because a lot of people that don't even know that they have it.
That's very true.
Some people don't have the symptoms, so to speak. So let's talk a little bit about what are some symptoms, or how can somebody find out if they have it?
Mm-hmm. It's very difficult, and it's hard to convince somebody that they need treatment when they feel perfectly fine, which many people do until their sugar is really hugely out of whack. But getting back to the fact of if you do have symptoms, what are those symptoms? Sometimes people will just feel tired, they may be thirsty, they may be urinating a lot, especially at nighttime. They may be getting infections, boils, sores, vaginal infections. Those would be the most common symptoms of diabetes. But as you mentioned, you may have nothing at all. It just runs in your family. You might be a little overweight, and that's why you need to be checked as a screening test just to see whether or not your sugar is elevated.
So when you talk about a screening test, I mean, can this be done? I know there's a lot of health fairs out there, or just even stopping in Express Care or your doctor's office.
Yeah, or I'm sure you know a friend or somebody in your family that has diabetes, because it's so common on Guam, and you can just ask them, hey, can I just check with the AccuCheck and just poke your finger? You just need a little tiny drop of blood, and as a fasting, meaning nothing to eat or drink after midnight. In the morning before breakfast, your number should be below 100. And you just remember that 100 number. If you're 126 or higher, that puts you in diabetes category. And I regularly see people, their sugar is 450, 500 even. Yeah.
Okay, so now if somebody is diagnosed with it, let's talk a little bit about their diet, what they should change. Mm-hmm. I was reading something that it's not necessarily just somebody having diabetes, you don't just get it from eating too much sugar.
No, not at all, and that's a big misconception that many people have. So as I said at the beginning, any food you eat will become fuel in your body, and that fuel is called glucose, and we know it as sugar. any food at all. Now the ones that raise your blood sugar the most are actually the fatty, greasy foods. Those high density foods, meat, fried chicken, those type of foods, okay? Now, plain sugar is also going to raise it, but if you had to choose one or the other, don't eat the fatty, greasy foods. Those are the ones that are really the killers, because they also will raise your fats, your body fats.
Okay, and so what can somebody do to start changing their eating habits, to start reducing it? Because once you have diabetes, you can't get rid of it, right?
Well, you can if you catch it early, and that's why screening is so important, because if you know it runs in your family, you get screened, and let's say your sugar is running 130, 140, with diet and exercise, you can turn that ship around and become non-diabetic again through the efforts of diet and exercise. Once you're up in the 250s, 300s, that's just never going to happen, and you're going to have to be on pills and drugs and shots and all the rest of it. But that's why it's so important to catch it early. So back to your question of what should you eat. The main word is less. You should eat less if you're a type 2 diabetic, okay? But I make it very, very simple for our patients, and that is to eat vegetables, and vegetables. And then there's 3 S's: soups, salads, and sandwiches, okay? If you're eating those 3 things, then you're not eating, for example, rice and fried chicken and pork chops. You're eating the lighter foods. You're still filling up. People are so afraid of feeling hungry, or what they have to give up. What you have to gain is a lifetime of health. What you have to lose is your limbs, your vision, your heart. So many terrible things that can happen to you. So you have to choose when you're eating your foods, and when you're selecting your foods, you have to have that long-term perspective.
So no more piling up that plate at the fiestas.
You want to go to the fiesta plate, see your plate, and put a little bit of this and a little bit of that, and then go back for seconds if you need to. But weight loss is critical for most of our type 2 diabetics. I go for the 10% weight loss goal, take 10% off your body. Imagine that. That's taking 10% off the load for your pancreas to have to take care of. 10% less work for your body, and usually it's achievable. People can do that over the course of a few months.
Okay, sounds good. Well, we will pick up our discussion on diabetes, diet, and drugs when Healthy Living returns. Stay with us.